This will just be a basic Medicare 101. I do have some more detailed slides if you have. I can stand. I do have some more detailed slides too once we get through these if you have specific questions, because some things are changing. It's Medicare. It changes every year. So who is SHIP? We offer free, unbiased, objective information on Medicare. We sell absolutely nothing. As we said when we passed around the sign-in sheet, we are a grant-based organization, and part of the grant in getting those money is outreach. How many people are you meeting and connecting with? Which is why we want to sign people in so we can get those numbers and get the funds. Our goal is to educate, assist, and empower Medicare beneficiaries. We don't care what you decide. You have to decide what is going to work for you. What is the appropriate path to take that's going to work for you? We provide much needed tools. Medicare can be confusing. People say to me, why does it have to be so confusing and so complex? I have a one-word answer: choice. If you all want exactly the same thing, fine, go sign up, you got it. If you don't all want the same thing, then you've got to have choices. Do you want this, do you want this, or do you want this? We can't have it both ways. It's one or the other. This is the way it is now. I'm sure things are going to change in the future. Don't ask me how, I've got no clue. We'll find out when you do. As I said, we're funded through federal grants for the ACL, the Administration on Community Living. And we have certain goals and outreach numbers that we're supposed to meet. There are SHIP offices in all states, in all areas. If you relocate, you can go to medicare.gov, and where it says find somebody to talk to, and it will bring up a list. It goes by zip code. We covered 13 counties in Middle Tennessee. There are 9 regional offices in Tennessee, and we're the Middle Tennessee office. What is Medicare? 3 basic groups: anyone age 65 or older, anyone under age 65 if they have been on Social Security disability for 24 months. And that's one thing a lot of people don't understand. Well, I was just approved for my disability. How do I get my Medicare? You have to be on disability for 24 months. Once you're on it for 24 months, just before the 25th month, you will automatically receive your card. Then the other 2 categories are the end-stage renal disease, kidney failure, and Lou Gehrig's disease. All of the services are administered through CMS, the Center for Medicare and Medicaid Service. That is the governing body that makes all the rules and policies, procedures for Medicare. Medicare Part A, that is your hospital. And when I say hospital, I'm speaking facility. That does not include your doctor coverage while you're in the facility. That is strictly your inpatient facility coverage. It also covers skilled nursing facility. If you go on hospice, that is administered by through Original Medicare. Even if you are on an Advantage plan, you can get hospice, but it goes back through Original Medicare. And blood transfusions. Those are the services you get through your Part A hospital coverage. Part B is your medical coverage. Primary care, specialist services, your outpatient, whatever it is you're needing, diagnostic test therapy, lab work, some of your preventive health care services, your annual screenings. That is all Part B, doctor and outpatient. Then there's Part D. That's your drug plan, your pharmacy coverage. That's where you get your drugs. It is administered by private companies that are contracted with Medicare. It's only available to those people that have Medicare. If you don't have Medicare A or B, then you cannot get a Medicare drug plan. You must be enrolled in the plan to get coverage. You don't get it automatically. When you enroll in Medicare, your card will say A, and if you're taking B, A and B on it. That does not enroll you in a drug plan. There's a separate process for the drug plan. And there's two ways to get your drug coverage. One is what is called the freestanding drug plans that go along with Original Medicare. And the second way is to have a Medicare Advantage plan, which provides doctor, hospital, and drug coverage all through the same company. Which one you choose is entirely up to you. There's pros and cons on both sides. You have to decide what's going to work for you for your circumstances. Part C is the Medicare Advantage plans. I call them a one-stop shop because your hospital, your doctor, your drug coverage, all through the same plan. Primarily, especially with the Advantage plans, if you're healthy, it can be very cost effective. There are plans that have no additional monthly premium other than your base Part B premium. There's at least one plan that I know of, or maybe two, that don't have co-pays for primary care doctor visits. But that having been said, with these plans, you have to use the providers in their networks. The bulk of them are HMOs. When it's an HMO, they will require you to have a primary care doctor. They will probably require referrals, prior authorizations. They have pre-certification. They have rules and regulations that you're going to have to follow to get that coverage. If you don't want to deal with all that, that's fine. Then go the original Medicare route. There are some Medicare Advantage plans. With the Medicare Advantage plans, you must have Part B. If you're just Part A, which is the hospital, you cannot have a Medicare Advantage plan. You must have both A and B. The prescription coverage. To be eligible to join a drug plan, again, you must have either A or B. You can get a drug plan if you don't have Part B, if you just have Part A. But you cannot get a drug plan if you don't have any Medicare. You have to live in the plan service area. The plans can be regional. There are many of them that do provide nationwide coverage, but you need to get whatever plan is going to work for you, and as far as signing up for a plan, they are regional. To be eligible to join the Medicare Advantage plan, you must have both A and B, because again, that covers both your facility, Part A hospital, and your doctor and outpatient coverage, so you have to have both in order to get an Advantage plan. You must live in the plan service area. You cannot be incarcerated, and you cannot live outside the United States. Recently, it's come up a couple of times that people said, and what does it cover out of the country? And my response is, forget it. Medicare generally does not cover any services outside of the US. Maybe near a border, there might be a little something if it's really close to a border, but beyond that, Medicare does not cover international medical care. There are some supplemental plans which we can talk about, which may. But as far as Medicare, don't count on it covering you if you're outside the country. I did put some information over there, and I was a little bit late getting it out, but the low-income subsidy, the extra help program, this impacts drug plans only. And I tell people, you've got to be careful for words. I'll get a call, I need some extra help. So immediately, my mind goes to the drug coverage, because that's what the extra help, the low-income subsidy program covers. They may just be meaning, I need some financial support for my Part B premium or something like that. Words mean something, so you have to make sure you understand. I have to make sure I understand what you're asking me when you say it. But the extra help program or the low-income subsidies impacts the drug plans. It is administered through the Social Security Administration. We do an online application for that. It will pay up to the average Part D premium, the deductible, and it lowers your copays. So it can be a good program if someone is lower income. It is income and resource guidelines that you must meet in order to qualify for it. So not everyone qualifies for it. And when you're looking at those guidelines, those dollars, and especially the income dollars, are gross before any deduction. People will say, but that's not what I get. So much goes into my bank, but the Part B premium has taken from it. That's not the number we need. It's gross. What is your benefit? And it includes all sources of income. Social Security, if you do any work, if you get any kind of pensions, any kind of money coming in from outside sources, it is all income, and it all goes towards that, and you have to meet those income and resource guidelines. For a single individual, currently it's $1,518 a month. For a married person, it's $2,058 a month. These numbers change on an annual basis. The first quarter of the year, probably mid-March, end of March, we'll get updated information, which will give us the new figures for 2019. But until then, these are the figures that apply. So, and as far as resources, again, resources are stocks, bonds, savings bonds, IRAs, mutual funds. It does include property, real estate, but not the home you live in. You can live in your home and own it. It can be $1 million home. But as long as you are living on that property, it will not be counted as a resource. A beneficiary I was talking to a while back, she had a home, she was not living in it, her grandson was living in it, and she didn't want to have to move him out. I said, that's fine. But no, if you own that home, you're not going to qualify for it because the value of that home, you are not using it, and that is money in the value of your home that you can use to care for yourself. So it's hard. But again, if it's an individual decision, everybody has to figure what is going to work for them. Medicare savings programs. This is sort of a companion to the Extra Help program. The Medicare savings programs deal with the Part B. If you're eligible for a Medicare savings program, it can pick up that $134 that comes out of your check. It pays the Medicare premium. It's administered through TennCare. It can pay for Medicare premiums and possibly deductibles and coinsurance. That's the way the slide is set up is a little misleading because there's only one level that pays the deductible and coinsurances. The levels are QMB, and you can see those. Single is $1,032 a month, married is $1,392 a month. That is a very low income. This is the group, the QMB. This is what everybody wants. It will pay your Part B premium, which is currently $134. You'll also get a little peach colored card in the mail, which will pick up the deductibles and the 20% that Medicare doesn't pay. But to get that, you have to meet these guidelines. SLMB, that stands for Special Low Income Medicare Beneficiary. The income is a little bit higher. It's $1,234 and $1,666. And again, you have to meet both of them. If one of them is a little bit higher, then you're not going to qualify. And then QI1 is the highest level, $1,386 for a single and $1,872 for a married person. The QI1 is a little bit different. It's a grant-based program. They've never run out of funds on it. But if they ever did, even though someone qualified, they might not get it. It has never been an issue. I won't speak to the future. These are the Medicare savings programs. And again, in order to qualify for them, this is gross income. People will call me and say, I want to get it, but I don't get that kind of money. I have to pay my mortgage. I understand that. This is gross. Each December, you should get that letter from Social Security. It says your benefit, it'll say for 2019 is on that top line, and then it says from that we are taking, and it lists whatever's coming out. The number we need is the number on that top line, your gross benefit before any deductions. And if you have pensions or any other funds, it's the same thing. It's the gross. It's the year-to-date, not deductions that have come out of it. It's the year-to-date figures. Resources, again, are stocks, bonds, savings bonds, IRAs. If you've got a 401, sometime I've talked to people, they've got a 401k that's got, say, $15,000 in it. Well, if it's $15,000 and it's over the limit, not going to qualify. They may not want to draw it out, and that's fine. But as long as that money is there, that is a resource that you can use to care for yourself, to do whatever you need to do to care for yourself, and that is counted as an asset. Now, if you call, one thing that I always ask for, I request your Medicare claim information. A lot of people don't want to give it, and I understand that. I really appreciate it, especially as it is now, where it is your Social Security number. Yeah, I know what it is. I don't know your number, but I know the format of it. But without that, we can't look up your personal record. We can do some generic searches and give you general information, but we can't actually access your personal record online. So have available whenever the person calls your Medicare ID information, have a full list of all of your medications, including the drug, the dosage, the quantity, how many you get at a time, how often you fill that prescription in your preferred pharmacy. Those are the things that we're going to need when we look at the plans to really see what are the best plans for you, because all of that impacts your availability. Once we get that information documented on Medicare.gov, it will stay there. You can update it and change it, but then next year when you go back in, it can be real quick to just look, make sure you're still on the same medicines, and then it's already in there so that it's there for the next time. Things to be aware of. If you don't sign up when you are first eligible, you can incur penalties, and they can be expensive. You are eligible for Medicare at age 65. The initial enrollment period is 7 months. 3 months before your 65th birthday, month of your 65th birthday, and 3 months after your 65th birthday. Within 3 months of your 65th birthday, you should be signed up. Now keep in mind, if you wait until after your 65th birthday, you will still get it. Your date is going to be moved out a little bit by a month or two. I'd have to actually dig out the book and look at it. As long as you enroll in the month of your birth date, I believe it goes into effect the next month, but if you wait to the next month, then you've got to wait to the month after that. The key is start 3 months before you turn 65. That's what I recommend people. Or if you are already age 65, you're working, sign up for Part A. As long as you've got 40 quarters of work under Social Security, there will be no premium for Part A. So you might as well have it. If you have an employer group health plan, you can decline Part B. You can take it if you want it. If you take it, you'll owe the $134 a month for Part B. But if you've got an employer group health plan, you're fairly healthy, you probably don't need it. So you can decline your Part B. Then when you know you're getting ready to retire, or basically when you know you're losing that group health plan, then you need to call Social Security back and say, okay, I've got my Part A, but now I'm losing my group coverage. I want to sign up for Part B. And they will send you some paperwork, one for you, one for your employer to sign up, to get you signed up for Part B. And they'll ask you when you want it to go into effect and all that sort of information to get that going. So the key dates there is start anytime before 3 months before your 65th birthday, or if you're getting ready to retire, I recommend starting 3 months before you know you're going to be retired. Now sometimes you may not know that far in advance. Understand that, things happen. But as soon as you know that it's coming up, and if you're in that 2 or 3 month window, that's the time to start to look around to get the information and see what's going to work for you. Okay? Part A. If you are late in signing up for Part A, you can be charged a temporary 10% penalty fee, and that is assessed for double the years you were eligible and did not enroll. That will hurt. That can be a lot of money. Part B, if you don't sign up, it is a permanent, never goes away. 10% penalty fee is assessed every year you were eligible and did not enroll. Again, you need to sign up timely or you will pay more money. Part D, your drug plan, that is a permanent, again, never goes away, 1% penalty assessed for every month you were eligible and did not enroll. I've talked to people, I didn't sign up for a drug plan, I don't take any drugs, I don't need a drug plan. Well, now they need a drug plan, and okay, they will be charged a penalty, and that is in addition to the premium, any premium for the drug plan. So make sure you sign up timely. That's the important thing. With Medigap and the medical underwriting, they can review chronic conditions or recent hospitalizations. They can charge higher premiums and deny you coverage. There is a guaranteed issue period on a Medigap policy. There's 2 criteria that have to be met for that guaranteed issue period. What guaranteed issue period means, they cannot charge you higher than the standard premium. Bottom line is it doesn't go through underwriting. They can't impose pre-existing condition waiting periods, and they can't turn you down. That is a 6-month period. That clock starts when you are age 65 and enrolled in Part B, both of those. So if someone is working, they sign up for Part A, but they decline their Part B, that clock won't start until they actually call Social Security, say, I'm getting ready to retire, I want my Part B. For the following 6 months, once you're over the age of 65 and enrolled in Part B, You can sign up for any Medigap plan they send. It's guaranteed issue. They maybe can say, do you use tobacco? And you need to respond yes or no. And that's it. Beyond that, you say, you discuss it, fine, I want your plan. Where do I send my check? You got it. Once you are outside of that window, except for very, very limited circumstances, you maybe can get a Medigap plan. I saw an ad on TV and I shuddered when I heard it. Call us, it's always open enrollment on Medigap plans. Well, it's not an untrue statement. You can always enroll in a Medigap plan. You can apply for a Medigap plan. That does not mean the company has to issue you a Medigap plan. They will go through underwriting. They can collect your medical records. They can say, okay, we'll insure you, but we got to charge you. You've got some things going on. We're going to charge you higher than the standard premium. We're not going to cover your diabetes, COPD, whatever, for the first 6 months. And they can flat out say, no, we don't want to insure you. And there are some people who have run into that, again, and simply have not been able to get it. So if you're going to want a Medigap plan, the time to get it is in that first 6 months. Now, the Medigap plan goes along with the original Medicare side of the equation, where you have your original Medicare, has Part A deductible, Part B deductible, you owe 20%. There is no cap on that 20%. That's the hard part. And these are Medicare dollars. They're not bill dollars, and there's a big difference there too. But it's 20% of the Medicare approved dollars in any calendar year. If it figures out to $2,000, then you're going to owe $2,000. If it figures out 20, you're going to owe 20. If it figures out to 200,000, then you'll owe 200,000. The Medigap plan comes behind it to pick up the Part A deductible and that 20%. So when you're first going on Medicare, that's the time to look at it and see, do I want to get a supplemental plan? Because if you're ever going to want it, you need to get it in that first 6-month window. If you are on a Medicare Advantage plan, you are not allowed to have a Medigap or Medicare supplemental plan. Now, the Medicare Advantage plans do have an out-of-pocket maximum, which means you know the maximum amount you may have to pay in copays for that year. It is a high dollar amount. So for a lot of people, although it can be good, that can be scary too. For most plans now, it's about $6,700. But if your copays don't total that, that's fine, you don't pay it. With the supplemental plans, you will have to pay your premium every month. You have to decide what's going to work for you. You have to look at your risk tolerance, your financial status, what you're comfortable with. So the annual enrollment is coming, October 15th to December 7th. During that time, you can change Advantage plans, you can change drug plans, you can make any changes that you want. And the changes go into effect on January 1 of the next year. Medigap and supplemental equal one another. They are the same, yes. Those two are interchangeable. I was talking to a gentleman, he called, he needed to sign up for a drug plan. And I always ask a basic question. Do we need to have the discussion about the two different ways you can get your services through Medicare? Nope, I signed up for my supplemental plan this morning. Okay, fine. We talked about the drug plans. He didn't even need, nope, this is the drug plan he wants. I'm on the application enrolling it. He said, and thank the Lord, it says about will you have other coverage. He said, no, I signed up for my supplemental plan, Blue Cross Blue Shield Garnet this morning. Blue Cross Blue Shield Garnet is a Medicare Advantage plan. I had to say, sir, stop. If I sign you up for this drug plan, I will be canceling your Blue Cross Blue Shield Garnet. You cannot have a freestanding drug plan in addition to Advantage plan. A lot of people think Advantage plan and supplement Medigap mean the same thing. Medigap and supplemental, yes, that's on one side of the equation. Advantage plans are on the other. And people are confused. A lot of people don't understand that. But I was so thankful he said that the way he did. I said, look, if I do this, that's fine, but it's going to cancel your Blue Cross. And I said, you need to think about that. Feel free to call me back, but I don't recommend we continue if the Blue Cross is what you want. He just simply did not understand. So make sure, and I've often had the feeling, do I have any questions on this topic? Yes, I do. I can't ask it because I'm so confused I don't know what to ask. You know, I get that. I get that. I'll sit there and like, okay, now wait a minute. I get that. I understand. Yeah, exactly. Yeah, I get that. It is confusing, and I go back to what I said earlier. Why? Choice. Do you want the original Medicare side? Do you want the Advantage Plan side? Do you want a supplement? Or do you want the out-of-pocket maximum? Two things I say to people. Number one, there is not a right or a wrong answer to these questions as far as which way you go. It's what you're comfortable with, what financially you want to do, what you can do, what you can't do. Only you know that. We don't. We have to leave that up to you because we're not you. We don't know you and what your likes, your dislikes, and anything about you. So you're the only one can determine that. The second thing is, pay me now or pay me later. When do you want to pay it? You can get a supplemental plan, pay your supplemental premium right along. It'll pick up your Part A deductible and the 20%. You don't actually have, supplemental plans are not mandatory. You don't have to have one if you have original Medicare. Right. If you don't have a supplemental plan, you'll owe the Part A deductible, $1,340. Can be charged up to every 60 days. So yes, you could incur that more than once in a calendar year. The Part B deductible is currently $183. That's staying the same. And then you've got your drugs on the top of that. You know, what's going to work for you? We can't answer that question. You have to figure it out. On the Advantage Plan side, you've got your out-of-pocket maximum. For most of the plans now, it depends on the plan you have. Most of them are about $6,700, which is a lot of money. But it's only, you don't have to hand anybody a check for that amount of money. It's just as you go through getting your health care, you see your doctors, you pay your copays, you go for your MRI, your CT, you go for your therapy, you pay your copays. As you get those explanation of benefits in, if those copays ever total, whatever the out-of-pocket maximum is, I don't care how much, but however much it is, if it totals $6,700 or whatever your plan's out-of-pocket maximum is, then you won't have to pay any more in that calendar year, which is better. To me, it's just a different way of doing it. And there's, like I say, there's not a right or a wrong answer. It's what's going to work for you. What's the best way for you to handle it. Senior Medicare Control deals with fraud and abuse. We can help with Medicare summary notices if you don't understand that. Inappropriate billing. Their motto is prevent, detect, and report. New Medicare cards. We just got notice that Tennessee's should be coming in the mail this month. We're in what's called the 7th wave. They've started sending them out. So just know that you will be getting a card with a new number. It looks weird is all I can say. It will not be your Social Security number. Be sure when you get it, look it over, make sure, now the number you have to assume is correct, but make sure everything else, the name and the dates are the same as they are on your current Medicare card. If they aren't, you need to call Social Security and say, I got this card, but it's got a different set of dates on it or whatever. Or if there's a misspelling, let them know so they can make sure it's corrected. It's random as far as when they go out and how go out. So if you're married, one of you may get it, the other one may not get it for a month and a half to 2 months. Who knows? Don't get alarmed. If by next April or May you have not received a card, call Social Security and say, I did not get my new card. Once you get your card, you're sure the information is correct, start using it. You can actually shred, tear up. Don't just throw your other card in the mail though. Again, shred it, get rid of it, burn it in your fireplace, out in your burner in the backyard. Get rid of it so nobody can get their hands on it. But those should be coming here. They started going out in April, and we've just been notified that Tennessee's will probably go out starting this month. Again, we provide free unbiased counseling on Medicare. We can do presentations like this to any number of people. We can help you enroll in either the drug plans or either of the Medicare Savings Program or the low-income subsidy. If it's something you're interested in and you want to volunteer, that's fine. Lori would love to have you. They're always looking for volunteers to come around. There are really only 2 main people in the office here in the Middle Tennessee group. The rest of us are all volunteers that come out. Saturday I was up in Gallatin. The week before I was, where was that? That was out in West Nashville somewhere. Next week I go somewhere else. If you want to stay busy, they can keep you busy. And especially at this time of year, over on the table I put some of our drug plan worksheets. You can fill that out, send it in, or if you have your information today, just fill it out and give it to me. We'll do a plan comparison of the drug plans for 2019 and get it to you. This is the main contact information. Allie is the full coordinator and Lori is our volunteer coordinator. They're both great gals. I work with both of them and they're both great gals. Yes, Medicare is confusing and they're always changing it. I don't see that change. I don't see that changing. Change is going to happen. There's things that do need to change. But just make sure you do understand. If you don't understand, ask questions. I hesitate telling you to talk to a broker. They're very nice people. There's nothing wrong with them. They're going to answer information on the programs and the things that they sell. Will they tell you about this one over here that they don't sell? I have no clue. They're going to want to guide you to their way. Again, we don't care what you do. We want to know that you understand what is going on and how to do it and how to access it. Now, there's a couple other things that aren't on here. Yeah, that's the end of it. Just so you are aware, in case you haven't heard, Medicare Supplemental Plan F and C will no longer be sold as of January 2020. They will no longer be sold. If you have an F and C plan, you can keep it. This goes along with the original Medicare side of the equation. You have your original Medicare, you get your drug plan, and have a supplement. As long as you pay that premium for those supplements, you can keep those plans. There are other plans that have discontinued previously. What we're already seeing, especially F plan, is what I call the Cadillac, because it picks up everything, including the Part B deductible. Then that's the change. As of 2020, there will not be a supplemental plan that will pick up the deductible. You will be everybody will be responsible for the Part B deductible. Those premiums are already starting to rise. And I see, once 2020 is here, them skyrocketing. What is the philosophy behind insurance? We're all paying our premiums into the pool. When he has a claim, they're going to go into those premium dollars and pull out and pay his claim. Okay, it's now 2020. You have no new lives coming into the pool. You've got an older population. Their health, realistically, may be getting worse, having more claims. There's fewer in the pool, people in the pool. The pool is shrinking. It is Medicare. We don't live indefinitely, so that pool will shrink. So what's going to happen to those premiums? Like I say, we're already seeing them creep up a little bit. There is another plan, a Plan G. The only difference between Plan G and Plan F is that Plan G doesn't pick up the Part B deductible. In the tool that we have where we can compare supplemental plans, I can tell you, you analyze, look at the F premium, annualized F premium, the annualized G premium, add $183 to it, and G is cheaper. Once 2020 rolls around, there will not be a guaranteed issue period for someone with a Plan F to flip in a Plan G or any other plan. If you're with an insurer that sells Plan G, if they want to allow you to switch into it, cool, they can. If they don't want to allow you to, they don't have to. So just be aware of that. There are changes coming to those Medigap policies. With the Medigap policies, there are 3 different rate types also. Attained age is your cheapest, but it's probably going to go up each year. Community rated, there's only one community rated plan in our area that the general public can get, and that is through AARP, United Healthcare. A premium's a little bit higher, but it stays more stable. Then there's issue age rated plans, and there's a couple of companies that offer those plans. I'm not a broker, don't ask me how they determine the premiums, I don't know. They're the most expensive, but they don't go up as much or as often. Which is best? Pay me now or pay me later. Only you, again, you have to sit down and run your figures and figure out what's going to work for you.